The story further, bring in Foster Mohale, who is the spokesperson for the Department of Health. Mr. Mohale, thanks very much indeed for joining us. It's been declared already as a continental security issue by Africa's top public health body. Talk to us about how it's impacting us here at home.
Yeah, you're absolutely correct that the CDC, Africa CDC has already declared Mpox as a public health emergency of continental concern. But as we speak now, I just came out of a meeting led by WHO in Geneva, where different countries, including South Africa, are presenting the state of Mpox in different countries, including the response effort. So South Africa is just presented now. So what does that mean? It simply means different now. All countries, especially talking about the announcement of CDC, it says all states on the continent, they need to work together as a collective, not as individuals, because now this disease is spreading from one country to another. In order to prevent what we experienced during the time of COVID-19, we need to ensure that we promote equal access to life-saving treatment, so that no country should be left behind. Number two, countries should be able to share surveillance data in order to establish the burden of this disease, so that we need to know what's happening in the neighboring countries where a need arises that we need to intervene. We need to do that. But lastly, the countries need to fast-track the approval of treatment and vaccine, ensure that there's access to this vaccine, especially by vulnerable communities. As we know that currently this vaccine and the treatment for Mpox is very scarce across the world. Lucky we are as South Africa, because we managed to secure a few doses through the interventions and donation by the World Health Organization.
We'll get to the issue of vaccines on the continent and here at home in just a moment, but I think perhaps important as well to emphasize the fact that while the disease causes flu-like symptoms, fever, muscle aches, large skin lesions, it can also lead to death.
No, definitely, especially based on as we know that we've already lost 3 patients due to this infectious disease, and like other countries like DRC, they've lost a number of citizens. Hence, we want to say 3 deaths are too many in South Africa. We can prevent the spread of this disease. We don't necessarily need to rely on vaccine or treatment, but the way we conduct ourselves, our behavior will be able to contribute towards the stopping the spread of this infectious disease by maintaining personal hygiene at all times, but also supporting those who tested positive and cooperate with the health officials when they conduct what we call contact tracing.
Right. Mr. Mohale, it's also very interesting to note that the disease is not a new one on the African continent, right? First detected in humans in the DRC some decades ago, in the 70s. It's only now, and you'll correct me if I'm wrong, over the last year or so, that new variants have emerged that spread more easily and pose much more of a risk to life.
Yeah, no, definitely, absolutely correct, because this disease is not endemic in most countries of the world. That's why even the manufacturers of vaccines and treatment, they don't produce a huge stock, because they know that the demand is very low. But as you know that now we are living in a time of a climate change, where tomorrow is not predictable. Even our scientists, they can't tell you what's going to happen tomorrow. So obviously the climate change has got a role in the current outbreak. Hence, we want to say for now, as the countries, we need to intensify our efforts, both surveillance, contact tracing, but also health education, because it's very important that we need to empower the communities with the right message, so that they're able to take well-informed health choices.
You were talking about the issue of vaccine availability, and this feels like such a recognizable discussion, doesn't it? We've just come out of COVID-19, where the issue of vaccine access was so high up on our agenda here on the continent. The continent says, and this is the Africa Centers for Disease Control, we need in Africa 10 million doses of the vaccine. We currently have, for the African continent, 200,000 doses available. You've just come out of a meeting with the WHO. What was said on the issue of more access?
Yeah, no, definitely. The same message was also echoed by Africa CDC that we need to work closely with the manufacturers of this vaccine to ensure that this vaccine is produced in enough quantity so that we will able to meet the demands on the ground. Because as the disease is spreading from one country to another and also mutating, changing the shape, from severity to less severity to severity, it means we need more vaccines, especially for the vulnerable groups. As you know that currently in South Africa, majority of those who tested positive are men. In fact, all of them are men, but majority of them are those who identify themselves as men having sex with men. So those are our part of our target group that we need to ensure that as soon as we access this life-saving vaccine, we need to start with those so that we to protect them, but also to prevent further transmission of this infectious disease.
Yeah, 15,000 Mpox cases, 461 deaths reported on the continent this year alone, a 160% increase from the same period last year. So when we talk about the situation here in South Africa, Mr. Mohale, in terms of vaccines and vaccine availability, what would be the plan? What would be the ideal for vaccination? Would it be as a response or would it be preventative?
Yeah, no, it's going to be remember, vaccine is for prevention. Treatment is for those who are already exposed to this or tested positive. So vaccine is mainly for prevention in order to boost the immunity of those who happen to test positive, especially those who are living with other diseases like your HIV, your TB, because their immune system is already compromised. So hence we are going to come up with an approach. We are not just going to start vaccinating randomly, as I indicated that we are going to start with the most vulnerable groups, and based on the data that we have at our disposal, is that majority of those who tested positive are those who are living with HIV and other comorbidities. A majority of those who tested positive are those who identify themselves as men having sex with men, and not only in South Africa but across the world. So meaning that as soon as we get hold of the vaccine, we need to prioritize those. So that's where we're going to be able to stop or prevent further transmission of this disease.
Right. And how many vaccines do we have in the country now versus how many we need?
So far, we don't have any vaccine. We've got a treatment for those who tested positive, which is not enough. It was donated by, I think we had about 40 doses or bottles of this treatment, about 40. But I need to emphasize that this Mpox specific vaccine treatment that we have is only for those who experience severe health complications after being exposed to Mpox. But for normal, less severe complications, we are able to use other treatment like your chicken pox treatment to treat Mpox, which we've been doing well. That's why not all those people who recovered, including those who recovered from Mpox in the country, they require this Mpox specific treatment. So that's why we only release as and when the doctors say, yeah, you need the Mpox specific treatment. So that's why we're able to survive with the little stock that we have. But it's not enough. But as I said, you don't know what's going to happen tomorrow. If the current variant or strain mutate and becomes less severe, more transmissible, it means we will need to up our game to get more doses as soon as possible.
Foster Mohale, Health Department spokesperson, thanks very much indeed for joining us.